just going to quickly mention what Jared just said in Spanish.
Entonces, dice Jared que su nombre es Jared Packard y él es director de alianzas estratégicas del colectivo urbano indígena. Jared, perdón, es de la nación Yankton, Dakota y Oglala, Dakota, del estado de Dakota del Sur. En el colectivo urbano indígena, al colectivo urbano indígena, perdón, le complace ser el anfitrión de esta discusión esta noche en compañía del Departamento de Salud para hablar sobre temas del idioma y las barreras al acceso para hablantes de idiomas indígenas. Estos videos en las distintas interpretaciones van a ser publicadas en el YouTube, en la página de UIC.
These videos with each of their individuals' interpretations will be posted to the internet later. My name is Thelma Carrillo, and for the last 3 months, I have worked in the Department of Health as a coordinator for Indigenous communities, and specifically during the pandemic. Today, we will present the first virtual conversation about a very important theme for Indigenous communities, which is access to services and information in Indigenous languages during the pandemic. This evening, our panelists include Fabián Huenala, who is Quechua and from Otavalo, Ecuador. As a social activist and artist, Fabián has dedicated the majority of his life to Quechua revitalization, language and cultural revitalization for Indigenous communities in Ecuador. Fabián is the co-founder of Quechua Hatari. Saúl Quizet Rivera Espino Barros is Tunasaví. He was born in the indigenous community Yupinani in Melatonoc, Guerrero, Mexico. Saúl and other members of his community now live in New York City and founded the organization Titoro Mico. Also with us is Francisca Coy, who is Quiche, from the community Tzumahui, Santa Catarina, Itzahuacan, in Solala, Guatemala. Francisca is an organizer of a group of women weavers in Guatemala. Daniel Kaufman will be talking about linguistic diversity. He is a professor of linguistics at CUNY in New York City, and he's also the co-founder of the organization, the Endangered Language Alliance. Ryan Dubois will be talking about linguistic rights. He's a specialist in human rights and works in the Commission of Human Rights in New York City. He's dedicated his work to themes related to justice, racial and economic justice. So our first panel consists of Fabián Huenala, Saúl Rivera, y Chica Coy, and we will begin shortly.
Okay. Entonces, Harad va a hacer las preguntas las va a hacer en inglés y luego yo las voy a interpretar y nuestros panelistas, empezando con Fabián, van a contestar la pregunta que Harad haga. Jared, we can...
Okay, thank you so much, Thelma. So our first question we're going to pose to Fabián, and the question is, what are the health needs in your Quechua community, and how do they relate to language needs? What have been your experiences as an interpreter in legal, social, and health services?
Sí, la pregunta a Fabián es, ¿cuáles son las necesidades de salud en su comunidad quichua y cómo se relacionan a las necesidades lingüísticas? ¿Cuál ha sido su experiencia como intérprete en servicios legales, sociales y de salud? Son dos preguntas.
Muchas gracias. Muy buenas noches.
Thank you.
Thank you very much.
And good evening, good afternoon to all those who are listening to us. I would first like to give some time to thank
First, I would like to
for this space,
take a moment to
and I would like to invoke
give thanks for this
Apachacamac.
space and invoke
Pachacamac, Creator of life, God of gods, we thank you for this great day. Mother Nature, we thank you for the heart, from the heart, to allow us to unite in the territory of our brothers, the Iroquois. Father, Son, with your energy, you provide light to our thoughts in order to find the right words.
Quisiera iniciar por la
I
segunda
would
parte.
like to start with the second part of your question from my own experiences.
Cuando llegué a este país,
When I arrived to this country,
después de haber llegado
a few days after arriving,
y conociendo de nuestro embarazo,
and knowing of our pregnancy,
por un chequeo médico,
we went to the hospital for a medical check.
con el incipiente inglés
With the basic English that one learns in the educational centers,
y ante la ausencia de
and given the absence of interpreters from Spanish to English in that time,
no sabíamos cómo solicitar a alguien que nos
or maybe because we didn't know how to ask for somebody to help us in that time,
o comprender lo que querían
we tried to guess and comprehend what they wanted to do to my wife.
la falta de conocimientos de nuestro
The lack of knowledge about our rights
y el funcionamiento del sistema de salud.
and the functioning of the health system.
No entendíamos claramente.
We did not understand clearly what they wanted to do with us.
Recuerdo claramente
I remember clearly
que yo me opuse a firmar una
that I opposed signing an authorization that they would make an exam on my wife, that they would extract her amniotic fluid. This practice was done to people of an older age that were or either drug addicts or alcoholics. For that reason, we said we didn't fit in that box for this type of experiments. No, however, in our second visit that my wife made, which I couldn't attend, she was subject to deceit. She was obliged to be subject to this exam, which provoked an premature abortion. My son was born of only 5 months and weighing only 1 pound and 4 ounces. Why do I make reference to this? The absence of interpreters or somebody that understands the dynamics in our communities makes us lack understanding and real exposition as patients to what we're being subject. Since that time, now that we have this COVID-19 pandemic, this reality of the health system in New York City has not changed. Or maybe it hasn't changed for us, the minorities, for the poor people, for the people of color, maybe for immigrants, for the original peoples, indigenous peoples. This hasn't changed. This may have never started. They have never given the necessary attention so that health centers become interested in the particularities and the prevention forms that indigenous peoples use. I particularly was victim once they took me for an emergency. The only thing I remember asking for was an interpreter from Spanish that could help me express my frustration, my anxiety, my exhaustion, my premature death that I was experiencing. I was 5 days in the hospital without a doctor, without anybody trying to understand what I was experiencing.
Creo que esto nos da una pauta de la
This gives us a pattern of the situation in which health centers find themselves. We all know that it's not only in health centers where we need interpreter services. We all know that interpreters and access to interpretation is one of our rights. A right that they sometimes give us in the courts, in the hospitals, in the educational centers, and the health centers, etc. Sometimes they do provide this. Sometimes the interpreters themselves don't understand the differences. And in their view, we're all mestizos, mixed blood. We're all Hispanicized. We all look Latino. And in the best of cases, they see us as, they identify us as Mexicans. But that's a great mistake. I think it's, in fact, our own mistake. Because from our own perspective, from our own experience, we have not been able to make visible our peoples. We have not been able to empower our languages. We have not been able to empower our demands in this city. I would like you to understand that we are not Hispanics. We are originary peoples, indigenous peoples. We are nations. We're nations who carry a language, a culture that is unique and diverse. Our ways of seeing, of living, of feeling are very different and distant from others and from each other. Our logic of thinking does not correspond to the logic of the Western thought, nor does it correspond to the capitalist society in which we live. We're peoples of different histories, with another logic, with other forms of organizing, communal organizing, with principles that are different, with economic organizing that is different, with health systems and practices that are different. But we are here to continue to make this city great and this country, because this land, this country is now the Pachamama, Mother Earth, the land of our sons and daughters. And from this perspective, from our languages and our cultures, must be interpreted and translated, and that we get the opportunity to speak in our own languages, to have interpreters that know our social realities and understand our realities, that they can transmit this. And we ask of this for the courts, for the medical centers, for the educational centers, and for others. To conclude, the only thing we want is to be respected and to be supported in our effort and struggle to continue to be ourselves. Many thanks.
Thank you, Fabienne. So we'll move on to the next panelist, who is Saul. So Saul, during COVID, how much information was available to your community?
Perdón un momentito, Jared. We're having some minor technical difficulties with the Quechua interpretation. So I'm going to ask Roberto if he can step in to do the interpretation in Quechua, please. Roberto, ¿me escucha? Roberto, Daisy está teniendo dificultades técnicas. ¿Podría usted, por favor, hacer la interpretación en Quechua? Estamos en el segmento de los documentos que le envié, estamos en el segmento que se llama parte 1. Parte 1 y de esto va a hablar Saúl. ¿Estamos listos? Roberto,
We apologize. We have had some technical difficulties in the translating the Quechua language. Roberto, a new interpreter will come in to do the interpretation.
You can continue, Jared. That's fine.
Okay. Thank you for bearing with us. So Saul, during COVID, how much information was available to your community in the, and I apologize if I mispronounce this, but the Tu'un Sabi language? What can New York City agencies do to better provide this type of information in the future?
During COVID, how much information was available for your community, the mixed community, in your own language? What can agencies do in the city of New York to provide this type of information in the future?
¿Qué pueden hacer? I'm sorry. I don't know if anybody, I was on the wrong channel, I'm sorry. Voy a repetir la pregunta. Saúl, perdón.
I'm going to repeat the question. During the COVID-19 pandemic, how much information was available for your Tu'un Sabi mixed community in your language? What can the New York City agencies do to provide more of this type of information in the future? Thank you. Well, first, I want to thank you greatly for the space that you've provided us today. From the day when I arrived to this big city, I came here in seeking a better quality of life, because many of our brothers and sisters are migrants, we're indigenous, we came out of our lands, because since I have memory, the indigenous peoples have always been forgotten. We have always been the most forgotten by our governments. They have stolen our resources, dispossessing us of our lands, but above all, they deny to us the right to a better quality of life. Many of us arrived here with a broken soul because we left behind fathers, brothers, mothers, sons, but we arrived here with many dreams and aspirations to be better, to arrive here, but we found many obstacles, including the language. Unfortunately, we never imagined that one day we would arrive to this nation. Now, in this health emergency, this adds tremendous difficulty for many of us, since on the part of the city, we don't find any information available in our languages, our indigenous languages from our descendant from our mothers. The lack of knowledge, the lack of diffusion, of dissemination of the rights of access to education and health, and many of our brothers and sisters do not come to the services, and they have died in their houses because they don't have the services, because they are afraid, discrimination, they have distrust of using the public services. This may have consequences for us in the future, because we could also be deported. It is for this reason that many of us have chosen to instead stay silent with fear and uncertainty that we know we are in vulnerable conditions in this great city. The majority of the indigenous migrants chose to rely on their own ancestral medicines, their own home medicines as well. Some of them did survive, but many did not survive during this pandemic. Sadly, many of them ended up dying in the same place where they lived, in their apartments, in their rooms, in their homes. Months before the emergency, before the health emergency, through the initiative of the workshops of the Department of Health and of the workshops that we undertook in the School of Justice and Peace and Health of the originary indigenous peoples, that was undertaken with the support in East Harlem, with the support of the health department. But this program, unfortunately, was defunded. In that workshop, we learned to weave, and with the 8 machines that we received, we continue with the same strength and aspirations to improve ourselves. Months after the health emergency, we used the resources that we received in the workshops in order to create masks, and for our families and for our communities, in particular for the people, for the elders. Also, this collective work contributed to our subsistence, but above all, the masks that we all produce ourselves, we're trying to contribute to stopping the coronavirus spread. Through our efforts, our lives are being saved. Through this communitarian efforts, we are supporting each other through our own forms. This has helped us to sustain ourselves and our own families due to the fact that the majority of our families have also lost their jobs. We are willing to continue working for our families, our communities, and our originary indigenous peoples. We also, but we do demand that ask that people help us to create this communitarian spaces to implement more strategies that enable us to advance the development, the practice, and the dissemination of indigenous languages in all media. And this dissemination is very much lacking. And that way, through these efforts, we can raise the awareness and conscience of our communities, in particular during this very difficult times within which we find ourselves. And that way, by supporting these efforts, we will not fall behind, and our fortunes will not be harmed as they currently are as a consequence of these factors. Many thanks for this space.
Thank you, Saul, and thank you for sharing that with us. And my condolences to all the people that have been impacted by this virus in your community. We're going to move on next to Chica. Chica, as primarily a speaker of the Quichua language,
we're going to move.
Share your experience and that of your community in accessing and receiving services in New York City.
How do the speakers of your own language and the indigenous language Quiché experience this, and can you share your experience in relation to how you've lived in New York City? As a speaker of Quiché, whose principal language is Spanish, can you share with us the experience of your Quiché community when trying to access health services in the city of New York? Before anything, good afternoon to everybody. To everybody who is listening to us through this medium. Guatemala, beautiful land, beautiful place of my origin. Invoking indigenous language. Good afternoon to everybody. My number is Francisca Chuicuy. I'm originary of Sololá, Guatemala. For me, it's a pleasure to share my experience with you as a panelist. It is very sad that today we're suffering through this pandemic. Do you understand why I say sad for me? Because being subject to discrimination, being discriminated by people who speak English, being discriminated by people who speak English. In first place, I want to share my experience with my son, who recently arriving to the United States. Arriving in January, towards the end of January. And when the pandemic came upon us, He is a son. He's a boy with epilepsy, unfortunately. And I went to the clinic to ask for help so they could give me medical attention. But unfortunately, when I arrived to the clinic, and the first thing they asked me is if they have immigration papers and Medicaid. And he hasn't yet applied for Medicaid because he just arrived. The saddest thing, when I arrived to the clinic, they rejected me there. Because he didn't have Medicaid. And they sent me to a different clinic. And I don't know if that was a private clinic. It was a private clinic. I didn't know that. When I arrived there with him, and they didn't give me medical attention for the exact same reason. I have health insurance. And because of that distancing, because of the isolation and the social distancing due to coronavirus, and many of the people there in the clinic told me that I have to go to the end of the line to wait for service. And they don't know that my boy cannot walk. So we ended up sitting there in a bench, and then they called me. And there they don't speak any Spanish, they only speak to you in English. And I wanted to ask them if I could get some help from somebody, but there was nobody to help me to interpret. And they asked me again for Medicaid, which my son doesn't have. And so we returned, and now he goes to school, and he went to school. And then I went to the school, and then they asked me, and where's the paper and the report, your boy's paper and report? And my boy cannot submit his work without. He was asked for a justification that proved that he had went to a clinic, and he couldn't get a justification of having missed class for going to the clinic. So I had to return to the clinic to ask for a paper that proved of his medical condition. So I arrived to the clinic. So what I did is that I texted one of my friends who speaks English, and she said, if they're asking you for documents, don't worry, I will try to text them and contact them. She told me to hand my phone to somebody in the clinic who could see the text message from my friend who spoke English. And so my friend asked the clinical personnel, the personnel in the clinic, to give her a document that would prove that my son was going to the clinic. And then once she had the paper from the clinic, she went to the school where her boy attends, and she displayed the paper from the clinic. The school personnel, they don't speak any Spanish, they only speak English. I was asking the people there who could speak Spanish that they could please interpret for me so that we could understand each other. So I'm finding all sorts of barriers in the clinic, in the school, in these times of but fortunately, I've always been supported by my friends. but also a lot of my friends share with me many sad situations that they're experiencing. It's very sad. One of a friend of ours, in their apartment, a friend of ours lives in an apartment whose landowner, and nobody, the landowner does not speak Spanish, and they certainly don't speak Quiche. I mean, I'm sorry, they only speak Quiche. My friend, many people in my community only speaks Quiche, they don't speak Spanish. Everyone in that apartment speaks only Quiche, so there's a double barrier from the indigenous language to the Spanish language to the English. The landowners thought that we could not pay the rent, or at least that's how they interpreted things, because a man came to ask for rent payment, but nobody in the apartment understood what they were being asked for, because nobody in the apartments actually speaks Spanish or English. But we gathered funds among us, and we paid the rent, notwithstanding the barriers. It is very sad, I say, because we need a lot of help in many ways, because I do feel rejected. We feel rejected. And I want to conclude. I want to ask the authorities that they must respect us as Maya people, as indigenous people. Thanks a lot.
Thank you, Chica. Thank you for sharing your stories with us tonight. The next will go to Daniel. And so, Daniel, I will pose a question. As a language organization, what recommendations do you have to suggest to the NYC agencies and infrastructure that would benefit these communities? I think you're on mute, Daniel. Yeah, there you go.
Perdón, la pregunta que se le hace a Daniel es, como organización de apoyo a los idiomas, ¿qué recomendaciones tiene que sugerir a las agencias y la infraestructura de la ciudad de Nueva York que beneficiarían a las comunidades que hablan idiomas indígenas y otros idiomas considerados minoritarios?
If you don't mind translating my answer, I just think if I have to improvise, I prefer English. So I think the first thing is to, dispel the ignorance around, I mean, there's a total lack of knowledge and understanding around indigenous people in New York City and their languages. For the average New Yorker, this is the Mayans and the Aztecs are things that you see in the museum. Most people have no idea that these are, that indigenous people are alive and well and all around us. And as I'll, at the end of my presentation, oh, sorry.
Interpretar. Dice Daniel, entonces no, va a hacer la presentación en inglés. Si recuerdo todo, a ver. Dice Daniel que pues lo primordial es, ante todo, es que hay mucha ignorancia sobre las comunidades indígenas en Nueva York. Solo se conoce de los aztecas, de los incas, a través de lo que se ve en los museos. Pero perdón, I'm sorry, we need to switch interpreters because we're now in the second segment of the presentation. Hoshin, I'm sorry, I don't know if that's been done already. Thank you. Okay, gracias. Entonces, eso es lo que él menciona. Continúa, por favor, Daniel.
And, the second, as I'll get to, is I believe that indigenous languages should have a special status in New York City. And in consideration that these are the languages, the original languages of the land, and also in consideration of the many, many linguistic and other challenges that indigenous people have faced, both those from North America and Latin America.
Dice que pues los idiomas indígenas tienen que ser reconocidos en estas tierras porque son los idiomas de estas tierras, son los idiomas originarios. Lamentablemente sí ha habido mucha discriminación en contra de ellos.
And maybe most importantly, I think we have to also dispel this idea that if somebody can get by in a language, like I can get by in Spanish, that's not enough, right? And this is often what happens to indigenous people from Latin America, is that yes, they, in the majority of cases, can get by in Spanish, but when you're talking about critical healthcare and critical situations, getting by is not enough.
Las personas que hablan estos idiomas lamentablemente sí tienen muchas barreras por el hecho de que sus idiomas no son reconocidos. Entonces se piensa que al hablar el poco español que ellos hablan enfocándose en los migrantes de América Latina, que es hablar un poco de español no es suficiente para tener un buen entendimiento de lo que son los recursos o de los servicios que haya disponible.
That's it. Should I, Elsa, you're on mute.
Are we moving on to the next speaker? Thelma?
I have a presentation that I don't know if this is for now or for the...
Yes, within that segment, you would be presenting about linguistic diversity.
Okay.
And Kate will be your interpreter. So this is the presentation you will be giving in
Spanish.
In Spanish, okay.
Okay, so I'll share my screen for that. Can everybody see that? ¿Pueden verlo todos?
Sí.
¿Sí? Ok, perfecto. Ok, mi tema de hoy es la diversidad lingüística en relación con geografía en territorios de origen y diáspora. Los términos dialecto.
My theme for today is lessons from mapping Indigenous language mapping in New York City. My topic today is linguistic diversity in connection to geography across home territories and diaspora, the terms dialect and language access. I'll focus on the indigenous people of Mexico, specifically the Mixtecs of Guerrero, but much of what I have to say is more broadly applicable to indigenous people from other territories as well. Linguistic diversity and the geography of inequality.
No se ve el mapa. Solo se ve, dice, well, congrats, you're using the latest version of Firefox. You need to select which.
¿Sí? ¿Lo ve?
Sí.
¿Ya? ¿Better?
Yes.
Sí, ya se ve.
Okay, good. Bueno, podemos comenzar con este mapa de lenguas.
With this map of indigenous languages of Mexico. Each point represents a community with an indigenous language, and each color represents a language group. The first thing that we notice is that the majority of indigenous languages are concentrated in the southeast. In the southeast states of Guerrero, Oaxaca, and Chiapas. Why is it like this? Diversity, this intense diversity has to do with the historical fertility of the area, but the absence of indigenous languages in many of the areas in the north is a direct effect of colonialism. Now we can see a different type of map. In this map, we see the percentage of the population that lives in poverty by state in 2005. The darker green zones are the areas that suffer from greater poverty, and the states in lighter green have less poverty.
Fue más bien la práctica colonial, no solo en México, sino también en Estados Unidos, entre otros países que nacieron del colonialismo. Si no podemos asimilarlos, es decir,
is it that zones with more languages have more economic problems? Why would this be? Is it that speaking many languages makes you poor, or that speaking an indigenous language makes you poor? Of course not. It's more because of the colonial practice, not only in Mexico, but also in the United States and in other countries where colonialism was prevalent. Thus to say that the idea was to convert people into Europeans in terms of language, culture, and religion. And they were completely excluded. And so those who rebelled and whose existence is an uncomfortable memory proves that this country was built on stolen land. Here we can see the diversity of the city of New York. This is around the area of Jackson Heights. The other neighborhoods around include Elmhurst and Corona. In bold, we see the lenguas francas, Spanish, Tagalog, Nepali, and Mandarin Chinese. And in normal letters, we see all of the rest of the languages. This is the Department of Health's most recent map of the percentage of COVID cases by neighborhood. Note the concentrations in Corona, Elmhurst, and Jackson Heights areas.
Y las altas tasas positivas, como lo indican los barrios.
Again, we can ask some stupid questions. Is it that multilingualism gives you COVID, or that speaking an indigenous language gives you COVID?
El multilingüismo te da COVID? Hablar una lengua indígena te da COVID?
Of course not. What we can see here is how easily colonialism spread. Marginalized communities cross barriers and live in marginalized communities of the urban diaspora, and they are obligated to live in very dense communities. So they are obligated they are also often obligated to do essential work, which puts them in contact with a large number of people, such as serving food or restaurant work, which is the main form of employment for Mixtecos in the United States. Also, driving Uber or working in restaurants are the main employment for the Himalaya, the indigenous people of Nepal. The linguistic definition of dialect versus language is based only on mutual intelligibility. Dialect versus language is a relation between two varieties of speech. To put it simply, if two people from different areas speak differently but can understand each other well without previous exposure, linguists would say they speak two dialects of the same language. If two people who speak differently cannot understand each other, we would say they speak distinct languages. We would say that the Spanish that is spoken in Mexico City, Chilango Spanish, and the Spanish that's spoken in Buenos Aires, Spanish Rio Platense, are in a direct relation to each other. They belong to a single language.
Hay otro uso más común de la palabra dialecto que tiene una historia colonial.
Unfortunately, there is another more popular use of the term dialect, which has a colonial history and which has confused things, an unofficial, unwritten language. In many parts of Latin America, to speak an indigenous language is referred to as speaking dialect, similar to how we can still hear speaking Indian in the North American context. But I'd like you to think about how far away Mexico City is from Buenos Aires, and think about the fact that those two varieties are in a dialectal relationship. On the other hand, when we're talking about indigenous languages, small distances often mean very large linguistic differences. Why? Because these languages have been developing on their own during millennia, where they are still spoken today. While Spanish has only Spanish varieties have only differentiated on this continent for a few centuries. The Mixtec-speaking area is shown in the pink box, the length of which is almost exactly the distance between Manhattan and the tip of Long Island. This is a preliminary map. The green dots are Mixtec communities.
Esa es su clasificación de las variedades mixtecas que en un momento se consideraron dialectos de una sola lengua mixteca.
On the left is Jasran's classification of Mixtec varieties, which were at one time considered dialects of single Mixtec language, but the difference between these varieties is so great that Mixtec is now considered a family, and many of these varieties are considered independent languages. So the term dialect is doubly confusing. It gives the impression of something less than a language, and it gives the impression of closely related varieties, which we see are both wrong. The third part is language access. What are the real consequences of all of this? This is Maximiliano Bazan, who used to be the only Mixtec interpreter for the New York court system. He speaks a Mixtec variety of Alco Sauca, but he had to interpret for Mixtecos from all over Guerrero and Oaxaca. In the European context, this would be like having a Spanish speaker interpret in Italian, French, and Portuguese. And what does the law say about this? Local Law 30 says the well-being and the safety of the city as a whole is put in jeopardy if the people of the city are unable to access city services or effectively communicate with city agencies. Local Law 73 mandates providing meaningful access. We must still first clarify meaningful. If you learn Spanish, your second or third language, in a restaurant kitchen, is it meaningful access to provide highly technical explanations in Spanish in critical health scenarios? Two, we have to move beyond a jeopardy-based rationale for inclusion. Three, we have to make a special legal category for Indigenous languages. That's my opinion. Thank you very much to everyone.
Thank you, Daniel. We appreciate your presentation and all of the definitions and kind of how you look at those and figure out ways that we need to change and look at language barriers and dialects and all those things differently. So I appreciate that. The final person that we are going to be having a question for is going to be Ryan. And Ryan works at the Commission of Civil Rights. And so Ryan, what options are available to these communities that the New York City Commission on Human Rights can assist with in reducing language barriers? And sorry, it's the New York Commission on Human Rights, not Civil Rights.
La pregunta, nos vamos ahora
We will now move on
moving to
the next segment.
To the next segment, yes. La pregunta para Ryan es...
The question for Ryan is, what options are available for Indigenous communities through which the Commission on Human Rights of New York City can help address the needs of Indigenous peoples? In first place, let me say that it's a great pleasure to be here, thanks to all the panelists and the organizers of the event. I will explain a little bit about the Commission of Human Rights and then how people can access our resources. The Commission of Human Rights is an agency of the government that implements the law of human rights. The human rights law protects people against discrimination, generally. The protections come in the form of so-called protected classes. A protected class is a group designated as a protected under the law. For example, protected in terms of race, color, religion, and national origin are protected classes. This means that a person cannot discriminate against someone else based on those characteristics. It is important to note that quote-unquote migration status is also a protected class. This means that a person cannot be discriminated because of their documentation status as an immigrant. Everyone living or working in New York City has the same rights, regardless of whether they are a citizen, have a visa, or are undocumented. It is also important to know that the Commission only... Another protected class is language, so that people have a right to speak their own language. It is illegal to prevent a person to speak their own language in a place of work. It is illegal for a business to reject a service because of your language. It is illegal for police to mistreat you for that same reason. It is also illegal to reject services by the government for the same reason. The government is obliged to offer interpreting service so that all people receive what they need. The language that you speak should never be an obstacle for obtaining services from the agencies of the government. It is important to say that the Commission only works in the 5 boroughs of the city. Neighborhoods outside of the city like Westchester, New Jersey, Long Island are not under our purview. There are other offices of civil rights that you can access there. Another thing, it is very important for people to not be afraid to raise a concern if they have been discriminated. If a worker raises issues because of discrimination by an employer and the worker retaliates against the business retaliates against the worker, the government would act and the courts would act in favor of the employee. The punishment for the employer would be, you should always issue a concern if you have been discriminated. Our contact information has been displayed on screen. You can contact us through 311, call 311 and say human rights. The operator will connect you with us. Another way is by calling us directly at 212-416-0197. You can also file a complaint on our website. You can also file a complaint on our website at nyc.gov/human-rights. If you have any difficulty connecting with our office, you can also contact me directly. All of the panelists and organizers have my information and can put you in touch with me to follow up on your case. Having said that, I give thanks for this event, for your participation, for the space.
Gracias. Gracias, Ryan.
Yes, thank you, Ryan. And now we're going to go to our last portion, which is envisioning linguistic justice in New York City. And I just wanted to kind of pose a general question to everyone and kind of give us what your thoughts are. What does linguistic justice mean to you? And
pose a question to everybody. What does linguistic justice mean to you? We're now in the last segment, in the fourth segment of this panel, of the conversation. The question that Jared is raising for anybody in the audience, anybody in the panel who would like to answer. How do we imagine linguistic justice in the city, in New York City? How do we envision a city where all languages are recognized and respected?
Voy a intentar.
I'm going to try to take this question and try to talk about it from the perspective in Ecuador that we've tried to recognize language and cultures. And thinking about the way that we've tried to do things within the structure of the state. Once we put our languages into these formal situations, it forces the official structures to recognize us. And it forces the language to be official in these distinct spaces. We have a lot of experience in Ecuador, thinking about the future, not just in Quechua, but in all of the diverse languages that we speak.
Que articulados con los hermanos nativos del norte, del centro.
We hope that with our native brothers and sisters in the north, and seeing how many indigenous languages are here in this city.
Nueva York al fin reconoce, aunque sea una lengua.
We need to say that yes, New York recognizes all of these as languages. That we're going to continue the fight as communities, as nations, that we need to fight in the city. I'll add a little bit to what Fabian said. This would help that our communities to be closer to healthcare. Many indigenous migrants, because they don't have access to spaces like this, they prefer to stay quiet and suffer, and sometimes big problems, sometimes psychological problems. And we need help sometimes. But because we don't find access, so yes, open spaces like this, and it would be important for this great city.
Thank you both. Is there anybody else who'd be interested? Chica, perhaps?
¿Y alguien más que le interesaría contribuir a esta pregunta? Yo creo que ya todos han mencionado también dentro de su discurso cómo, ¿no? Elaboraron a través de sus experiencias lo que es no tener un acceso justo, un acceso lingüístico justo.
I think everyone also mentioned in their presentations what it's like to not have just language access. Thank you very much to all of the panelists for everything that you shared. We're going to take 5 minutes to see if there are any questions from the participants who are listening.
Una pregunta que viene, me parece, no sé si venga de Guerrero mismo. Sergio Ferrer nos saluda.
There's a question that I think comes also from Guerrero and asks, in the future, within these digital spaces, we could be considering in the future that we can be collaborating between nations as well, doing these types of presentations in collaboration with the communities and thinking about collaborating with the ancestral lands that we all come from.
Bueno, eso más que nada, más que una pregunta, fue un comentario, ¿no? Y bueno, definitivamente en estos espacios digitales todavía tenemos mucho por aprender.
In these digital spaces, we still have a lot to learn, and we have a lot of limitations. And as we've seen, it's not easy. And in particular, it's complicated when we want to hear directly from the voices of people from indigenous communities. And this is something that I've seen with my own eyes. A lot of times, what we see is that it's other people who are speaking for us about our own experiences. And so this type of experience is giving the possibility of creating other types of ways to participate and who participates. And of course, we need to be flexible because as happened today, we had some technical issues, but we thank everyone for your time, for your participation, to all of the participants who are listening. Thank you so much.
Yes, thank you. And I just want to add to that, I really appreciate Thelma. I want to give a huge round of applause to Thelma. She's been really critical in making this whole thing come together. And, it wouldn't happen if it wasn't for you. So I wanted to just give you kudos and say thank you very, very much. We're very grateful. And everybody, you'll be able to find the recordings of these in your language on the Urban Indigenous Collective website, the YouTube channel. So if you go to YouTube and look for Urban Indigenous Collective, you should be able to see these posted within the coming week. And that's all I want to say. I just want to say thank you all to the panelists. Thank you to Daniel and to Ryan and all of our interpreters. You know, this kind of like what Dama was saying in the beginning, this is a very rare and, you know, first time event that's been happening, and to have it in so many different languages and indigenous languages. So we're really grateful to have been a part of this. So thank you.
Dice Harad que van a encontrar todas las grabaciones, ¿no? Todas las grabaciones van a estar en la página de YouTube del Colectivo Urbano Indígena o Urban Indigenous Collective. Vamos a repasar las grabaciones porque sí tuvimos algunos problemas técnicos, pero vamos a poner las mejores grabaciones que podamos tener en ese canal de YouTube. Y nuevamente muy agradecidos a todos los participantes. Si no hay ningún comentario más, pues entonces hemos terminado.
Gracias a todos. Gracias por el espacio.
No, gracias a ustedes.
Muchas gracias.
Gracias, Telma. Muchas gracias a todos.
Gracias. Perdón, sí se me olvidaba una cosita, si es que todavía no se van. Y a los que están en los participantes, si por favor serían tan amables de hacer una encuestita. En el Departamento de Salud hacemos este tipo de, perdón, no sé si puedan ver mi pantalla, a los que todavía están aquí, no se vayan todavía. En el Departamento de Salud, por favor, manténganse en contacto. Si necesita asistencia llenando una mini encuesta sobre el evento, indique su asistencia a este evento a través de este vínculo, y me parece que mis compañeros van a incluirlo en el chat box. Y si tiene alguna pregunta, un comentario o alguna sugerencia al Departamento de Salud, por favor.
I want to add, please, if you could, if you've been participating in this event, please go to this link and indicate that you have participated in this event. It's a very small survey. We will also be putting the link in the chat box. And please also, if you have any questions or comments, please send them to this email.
Este gran vínculo, y lo vamos a compartir también en el chat box. Sara me parece que va a compartir esta
We will
información.
also be sharing this link in the chat box. This is a link to be able to stay up to date about the pandemic.
Se pueden enrolar en estos informes, en estos vínculos, y ya se los mandó a los participantes, a los panelistas, pero también lo pueden ver en el chat box, me imagino.
Now you can see these links in the chat box.
Y por último, también tenemos otras, está en la página del Departamento de Salud.
And lastly, we also have the website of the Department of Health about the pandemic. And here is some more specific information about the communities based on zip code and what's happening in each zip code.
No sé si lo están compartiendo mis compañeros. Aquí están. Sí, muchas gracias.
Yes, here they are. Thank you.
Ahí están. Gracias por compartir los equipos. Son un gran equipo. Sí, tuvimos mucho apoyo y muchas gracias. Hay mucha, como les mencionaba.
Yeah, we had a lot of support. As I was saying, this is basically a historic event because in the Department of Health, this is the first time that an event like this has been done with support for interpretation in Indigenous languages, with interpreters from the same from the actual communities in the city of Nueva York. And so we hope that we can continue to do this type of event and continue sharing our knowledge and experiences with each other. There's a lot of enthusiasm because this has opened a lot of doors and a lot of possibilities. And so thank you very much for being part of this. Thank you to you, Thama, for all of the fighting that you're doing. Yes, we finished. Have a great night. Bye.